new, maybe it's healing. This is lifting the floor of the maxillary sinus. And there is a secondary inflammation of the Schneiderian membrane, okay? This is an important diagnosis for all of you to know, because the ENTs, the doctors, the ear, nose, and throat doctors, they don't know this diagnosis. Or maybe some of them do. And they will not diagnose this patient as having a dental problem. And they'll do surgery for the patient, for the nose and the sinuses. They will give them medication, and the sinusitis doesn't go away because they don't solve the problem, which is the infected tooth. Okay? You are the key to the correct diagnosis because of your knowledge of dental infection. Okay? And cone beam CT helps you make that diagnosis and helps you prevent unnecessary treatment in a patient. Okay. So, going back here. So those are the sinuses. Okay, so now we're going to go all the way back up to the top of the nasal cavity. The top of the nasal cavity, we're comparing the two sides to one another. This is the nasal septum. And as we're going down, we're looking for any deviation in the septum, any breaks in the septum, and any abnormalities. We want there to be air-filled spaces around the turbinates. These are the middle turbinates, all the way through. And we want continuity here. And in this patient, we have this discontinuity. So there's a hole in the septum. And this is not normal. And the differential diagnosis of this condition includes the use of cocaine. Okay? So the use of cocaine into the nose, any drug that you inhale has a vasoconstrictive property, and it can kill the underlying cartilage by cutting off the blood supply due to that vasoconstriction. Also nasal sprays for sinusitis, you have to be careful with those and direct the spray outwards and not inwards so that you don't create this kind of a situation, okay? So here is a lack of continuity of the septum, which is a finding. We want no soft tissue densities in the air-filled spaces all the way down to the bottom of the nasal cavity. The next thing we're going to do is we're going to go to the top of the nasopharynx, and this is the nasopharynx here. And we're looking for symmetry, okay? Symmetry in this. Of course, there's a lot of anatomy here, but I'm not going to go through it. I'm making this simple for you. Symmetry in the nasopharynx, symmetry in the oropharynx. This is the uvula right here. These are the palatine tonsils. Symmetry, 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 all the way down to the epiglottis right here, and these are the lingual tonsils. Okay, that's all the way down to the bottom. Now we're going to go up again. Those are all the black spaces. Now we're going to look at the white things. We're going to look at the bone. And after we go through the cervical spine and skull base, we'll take a break and we'll come back and do maxilla and mandible, okay? So bone has cortical outlines and medullary spaces. Here's the hyoid. These are the cervical vertebra, okay? Once again, there's a lot of anatomy, but you look for cortical continuity and medullary spaces that are uniform. The cortices need to be continuous. This is a little nutrient canal. This is within normal limits for the cervical vertebra. Going through all these to make sure that the bones have a continuous cortical outline and that the medullary spaces of these bones are uniform. This is foramen magnum. Now, the part I'm about to show you now is a little bit complicated. I will just show you just how much anatomy and how much learning you have ahead of you. And like I said, you can send the scan to a radiologist to read it for you if you don't want to learn this stuff, okay? This is a countdown of the cranial nerves. Hypoglossal nerve, cranial nerve 12. The jugular foramen, which has the jugular vein cranial nerve 9, 10, 11. The carotid canals, okay? So the carotid canals. The next one is going to be the internal auditory canal that has cranial nerves 7 and 8. Here we have the ear structures, the inner ear, the middle ear, the mastoid air cells, and of course the external auditory canal. Okay? All these things I'm telling you is very complicated, but you can, until you learn it, you can have a radiologist help you. This is called the Vidian canal. The Vidian canal. This is foramen ovale, okay, where the mandibular nerve goes through. This is spinosum, foramen spinosum, that has the middle meningeal artery. This is rotundum, which has the cranial nerve, trigeminal nerve second division go through, okay? And then this is the superior orbital fissure, which has cranial nerves 3, 4, first division of 5 and 6 go through. This is the sella, this is dorsum sella, and then moving all the way to the optic canal, which is cranial nerve 2, and this is cranial nerve 1. Okay? We're looking at all these bones, making sure that the cortical outlines are continuous, the medullary spaces are uniform, focusing on all this stuff. And then now back to the top of the scan, we're going to take a quick look at the soft tissue outline of the outside, also the soft tissue uniformity here. You cannot diagnose anything in the soft tissue. It's impossible because on cone beam CT, you can't tell the difference between different soft tissue structures, but if you see a calcification in the soft tissue, you'll be able to pick that up. If you see a destruction of bone adjacent to a soft tissue tumor, or a soft tissue going into an airfilled space, you'll be able to see that. But that's the extent of it. So you're looking for calcifications, and you're looking for destruction of bones and changes in the air-filled spaces. So taking it all the way down into the neck to make sure that there are no calcifications anywhere in the soft tissue. Okay? Okay, great. So why don't we take a little break? You've absorbed a lot right now. After the break, we'll talk about the anatomy of the maxilla and the mandible, and we'll talk about how to look at the teeth as well.